This year's AUA 2019 had a number of exciting and innovative take-home messages with relationship to imaging. I'll focus mostly on the prostate in this talk. One of the exciting developments presented at this year's AUA was regarding high-resolution micro-ultrasound. One of the abstracts presented by Dr. Pavelovic et al. Was a study that examined the detection of significant prostate cancer, comparing high-resolution micro-ultrasound over conventional ultrasound. High-resolution micro-ultrasound has a frequency of approximately 29 megahertz with resolution down to 70 micrometers. This study was performed across 5 institutions in North America, including 1,676 men without known prostate cancer. And of these, 1,109 per protocol subgroup had correct sampling at the apex. They used the Primus score, which is a scoring system rating from 1 to 5 for lesion risk. And the primary outcome was the detection of clinically significant prostate cancer, defined as greater than 50% core involvement or Gleason grade 2 or higher cancer. They found that the micro-ultrasound technique was able to detect more significant cancers in the per protocol analysis, 44% versus 37%. There was no difference in the detection of insignificant prostate cancer, and they conclude that the second generation commercial system had improved features with image quality. So this system may be readily adoptable and may have improved sensitivity to detect significant prostate cancers over conventional ultrasound. A number of abstracts this year focused on 18F fluciclovine PET imaging for prostate cancer, and the role continues to be refined, and a number of abstracts were presented at this year's conference. One abstract by Alam Mozaffar and colleagues examined the 18F fluciclovine PET, and they found that it was useful for pre-treatment staging for high-risk cancer with high specificity for detection of positive lymph nodes. Several abstracts were able to show that in men with biochemical recurrence, the fluciclovine PET has low yield when PSA is less than 0.5 and improves with increasing PSA. And other abstracts were able to show that it can potentially guide lymph node dissection during surgery or oligometastastectomy. And finally, there was many abstracts that examined the gadolinium PSMA PET, both as an emerging role for the primary staging of prostate cancer, but also in advanced disease and within PSA failure. I'll highlight a few of these abstracts. One study by Lopsy and colleagues examined the role of gadolinium PSA PET with the detection of clinically meaningful prostate cancer. They performed a prospective observational study utilizing PET transfusion in 88 patients. This population included those with negative prior multiparametric MRI and with patients with positive multiparametric MRI but negative biopsy. These patients had persistent elevated PSA or elevated PHI index, and they had a previous negative biopsy or negative DRE. They were able to show that using the PSMA PET, they were able to define optimal cutoff points with a SUV max of greater than 5.4 and an SUV ratio greater than 2.2 that could identify clinically significant prostate cancer of Gleason score 7 or greater with an accuracy of 86% and 91.5% respectively. In summary, they found that in patients with a high suspicion of cancer, especially in the setting of negative prior biopsy and or multiparametric MRI, that the PSMA PET was capable to detect malignant lesions and identify clinically relevant prostate cancer with high sensitivity. Another study examined the role of PSMA PET versus fluciclovine PET for detection of prostate cancer at early biochemical recurrence. An abstract by Calais et al. Was one of the late-breaking abstracts. They performed a prospective single-center, single-arm phase 3 study of 50 patients with biochemical recurrence after radical prostatectomy without salvage therapy. They defined early biochemical recurrence as PSA between 0.2 and 2.0, and these patients received both PSMA PET and fluciclovine PET within 15 days. and the primary endpoint was detection rates. And the detection rates were significantly lower with fluciclovine PET than with PSMA PET in the pelvic region and for any extra pelvic lesions. The reader agreement among different interpreters for the PSMA PET images was significantly higher for PSMA PET than for the fluciclovine PET, and they conclude that the PSMA PET should be the imaging modality of choice in patients with early biochemical recurrence. So in summary, the gadolinium PSMA PET appears to have promise for a number of different scenarios for the treatment of prostate cancer. These include the initial staging for high-risk disease, early detection of biochemical recurrence, and it may potentially enable radio-guided surgery for salvage lymph node dissection.